and we will go ahead and begin the second morning session. Earlier, we illustrated the treatment of end-stage disease, and presently we will focus more on disorders of the native hip, diagnosis, and some of the treatment methods that we'll illustrate in our surgical cases. But before we do that, once again, Saenz will come back and share with us some orientation to the anatomy of the hip, especially with regards to the labrum, which is the most common pathology that we encounter in the native hip.
Thank you very much. Well, I will go to talk about the labrum, the acetabular labrum. This acetabular labrum to introduce the thigh surgery. The acetabular labrum is a fibrocartilaginous ring attached to the margin of the acetabulum. Here, in this image, the cut surface of the labrum is described as a triangular anatomy textbooks. Here we have the anterior labrum, and here the posterior labrum. Much has been written about the shoulder labrum, but studies describing the morphology of the acetabular labrum are scarce. It has three surfaces: an external surface contacting the joint capsule. This face allows insertion of the coxofemoral ligaments joint, the iliofemoral ligament and the pubofemoral ligament. This is the iliofemoral ligament, a representation over the picture. The iliofemoral ligament attaches in the anterosuperior area of the acetabular labrum, and the pubofemoral ligament attaches in the inferior part of this anterior acetabular labrum. Posterior, in the external surface of the acetabular labrum, the ischiofemoral ligament posteriorly attaches in the posterior surface of this labrum. The internal surface, this internal surface, it's a joint surface. The acetabular labrum increased articular surface up to 50%. This is the prolongation of the acetabular surface. And the basal surface attached to the capsular bone and transverse ligaments, the distal edge is free, forming the lateral limit of the acetabulum. Anteriorly, the labrum is equilaterally triangular in radial section. It's triangular in this transverse section. The posterior acetabular labrum is slightly different from the anterior part. Here we have the posterior region of the coxofemoral joint. Here is the posterior labrum, and here the attachment of the posterior capsule. Posteriorly, it's more bulbous and lip-like, dimensionally square, but with a rounded distal surface. It's more rounded, the labrum posteriorly. Posterior labrum, and this is the posterior capsular attachment. Rectus femoris. The rectus femoris muscle is another important structure at this region. It has two heads. The direct head attaches in the anterior inferior iliac spine, and the reflected tendon surrounds the superior acetabular rim. It may be sometimes necessary to cut the reflected head to the rectus femoris to improve access to the acetabulum. Finally, sometimes we can find an abnormal contact between the anterior acetabular rim and the femoral neck. The femoral acetabular impingement may be caused by an osseous bump on the femoral head-neck junction, like we show on the left dissection. This is the osseous bump, or by an overgrowth acetabular rim. Thank you very much.